All right, today let's cover some exciting new research just published last week in the journal Proceedings of the National Academy of Sciences, looking at how nutrient timing, specifically timing your meals, impacts mental health, specifically depression and anxiety. And I've covered this topic, not the meal timing aspect of it, but the circadian rhythm aspect of it in my book and in other places, because your circadian rhythm is very important to your overall health. And I talk about in my book how artificial light at night causes circadian rhythm dysfunction, which promotes metabolic dysfunction and immune dysfunction, insomnia, can exacerbate autoimmune disease and all kinds of issues. And we've made multiple different videos on circadian rhythm dysfunction and sleep and immunity and those topics. And so this study snaps into all of that, because this study looks at creating, they artificially created circadian rhythm dysfunction in order to study how meal timing impacts depression and anxiety. And so this is relevant to humans in the form of shift work. If you work third shift, work overnight, jet lag situations where, again, you're crossing time zones and circadian rhythm can be an issue. And anybody that, has circadian rhythm dysfunction or a sleep wake cycle that does not match the sun's. And so you can see here, this study entitled Daytime Eating Prevents Mood Vulnerability in Night Work essentially starts off by saying shift workers have a 25 to 40% higher risk of depression and anxiety, partly due to misalignment between their circadian clock and their daily environmental behavioral cycles. And so that's a long sentence to say, if you work third shift, you have an increased risk of mental health disorders, partially because you're awake when you should be sleeping. And again, there's lots of factors there, one of which is the artificial light at night, which will change your cortisol and your melatonin cycles, which again promotes inflammation and infection and immune dysfunction and blood sugar dysregulation. So knowing that, these authors then say, okay, well, how does food timing snap into that whole picture? And the quick and dirty of it is that they took two groups and they induced circadian rhythm dysfunction. They kept them up so that they were having to be awake at night. And one group ate in the daytime and at nighttime. The other group ate only in the daytime. And when they looked at the numbers, the group that ate at night and during the day had 26% increased risk of depression and 16% increased risk of anxiety, compared to the group that only ate in the daytime. The group that ate only in the daytime didn't have any increased risk. And so they said, quote, importantly, a larger degree of the internal circadian misalignment was robustly associated with more depression-like and anxiety-like mood levels during night work. Okay, so if you're in a scenario where you're a nurse, say, and you work third shift, and there's no way around it in your current situation, then what you can do to help prevent the depression, the anxiety, that the increased risk of those things that comes with shift work, is you can work to time your meals to be eaten only during the daytime. And that will help prevent increased risk of depression and anxiety. And this is the research paper, and then here is the news article on it from Science Daily. And what they say in here is a couple of interesting quotes. So the lead author says, our findings provide evidence for the timing of food intake as a novel strategy to potentially minimize mood vulnerability in individuals experiencing circadian misalignment, such as people engaged in shift work, experiencing jet lag, or suffering from circadian rhythm disorders. The timing of food intakes matters for our mood. Shift workers account for up to 20% of the workforce in industrial societies and are directly responsible for hospital services, factory work, and other essential services. Shift workers often experience a misalignment between their central circadian clock in the brain and daily behaviors such as sleep, wake, and fasting eating cycles. Importantly, they also have a 25 to 40% higher risk of depression and anxiety. So the take home is that meal timing is emerging as an important aspect of nutrition that may influence physical health. And if we jump back to the study, there's a new area of research that they're calling nutritional psychiatry. And here's where this is where the timing of meals snaps in. And there's been an early study looking at 500,000 individuals that showed an association of an unhealthy diet with worse sleep quality and mental health symptomatology. And importantly, individuals experiencing depression often report poor quality diets with high carbohydrate intake. In contrast, there's evidence for an association of the Mediterranean diet with lower odds of depression, anxiety, and psychological distress. Nighttime work with daytime and nighttime eating using meals that had about 50% carbohydrates in them impaired glucose tolerance, whereas no such effects occurred in nighttime work with daytime eating only. Okay, so there's the key from the study, is that everyone did the shift work, but only the ones who ate at nighttime while doing the shift work had the increased risk of depression and anxiety. So the key is, again, if you're looking to prevent that or minimize that, from a meal timing perspective, you can contribute to reduce risk by only eating during the daytime. So I think this is a big and important addition to what we already understand in terms of working with shift work and minimizing the circadian rhythm dysfunction and the impact of that on a person. And so if you are a shift worker and you're eating overnight, use this research to encourage yourself to time your meals during the day. Now, the next question might be, well, that sounds good, but if I'm working a night shift, that means I'm 8 to 12 hours in the dark working, and there's very little daytime that I'm awake because, if you're working all night, you're probably going home and sleeping during the day. Well, then you might, one thought would be to structure your meals in an intermittent fasting type of strategy where, you're only eating during the daytime. So most of your day that you're awake, it may be dark. So you want to pile your meals in the daytime hours, whenever those are. And that might have to be before work and after work, depending on how long your shifts are and how they fall.